It's expected that in 2020 we're going to be over 1 million nurses short in the United States.
Could I ask you a question?
Yes,
in your duties, do you see a lot of this problem that I was talking about readmissions, people?
Every single problem you have mentioned, I have seen, and I see daily. So I agree with all of your issues on healthcare reform. As a nurse, it's hard for me to know all the fiscal answers, and I would leave that to your expertise and the experts that you used. But from a nursing point of view, I definitely would like to see more primary care physicians.
How do you, in your view, can we, one, get more people in the nursing profession, and two, more primary physicians?
From a nursing care perspective, most of the nurses my age are retiring, and that includes faculty. Last year, almost 100,000 qualified applicants were turned away from nursing schools in the United States because there were not enough faculty to teach them. So there does need to be some fiscal responsibility to increase nursing going on to become faculty in nursing schools. And
Can we do this through financial incentives?
Certainly through financial incentives, giving back to the community, nurses that are willing to take positions in faculty and work in areas that are underserved to get more nurses in the United States.
Thank you very much.
You're very welcome.
Investigation. So far, I do not think there has been. Yes, you're back. Wait till the microphone comes to you. A little closer.
Hello? Hello.
Can
you hear me now?
Mechanical failure. It's intentional. No, go ahead. We'll get you. We'll get you now.
Is it working now? I just want to thank you
You're
for
fine.
letting us come as we the people to express our concerns about our country. We love our country and we are very concerned. I went last week to the rally and stood in front of the convention center across from Acorn, and I noticed a t-shirt that said HR 676. It's an old bill that's being reemerged, and they chanted healthcare now, healthcare now. I didn't know anything about it, and I haven't heard anything on Fox News, and so I went home and did homework. And I found out that 676 is now on the House floor as the Wayner Amendment to HR 3200 legislation. The amendment will replace Division A of HR 3200, will make it a single-payer legislation. So all their talk about co-ops and public option, we will become a single payer. The bill actually states that the United States National Health Insurance Act established a new, unique American universal health insurance program with single-payer financing. The bill would create a publicly financed, privately delivered health care system that improves and expands the already existing Medicare program to all U.S. residents and all residents living in U.S. territories. And then it says eligibility. Every person living and visiting the United States and U.S. territories will receive a United States National Health Insurance Card and ID number. How do they plan to pay for this?
How long is it?
It's just how they say to pay for it. Maintaining current federal state funding for existing health care programs. A modest payroll tax on all employees and all employers of 3.3% each. A 5% health tax on the top 5% of income earners. A small tax on stock and bond transfers. Closing corporate or tax loopholes and repealing the Bush tax for the highest 1% of income earners. Do you know about this bill, sir? And do you know the validity of this?
With typical Senate snobbery, I do not know of a House bill. But look, I've heard of similar proposals, and that has come from the liberal left in America. I understand that, and I respect their philosophies. I respect their views, but obviously I would vehemently oppose such a proposal. But that's what we are looking at as this comes from the people in this country, in all sincerity, who believe that a government-run healthcare system is best for America. By the way, if you like that, you'll love cash for clunkers. But the point is that I would never support such a proposal. I had seen those proposals around, and obviously the quote public option to whatever degree it is, in my view, is the beginning of the end of private health insurance in America because of the advantage that it would give to the government plan. If you're an employer and you can get a health insurance plan that's less expensive, at least initially, from the government, of course you're going to take it. And of course, if you're facing a fine, that you're either going to pay the fine and have the government provide the health insurance, or you're going to adopt the health insurance policy that if it's not government run, then it has such high requirements that it basically is harmful for your ability to hire and keep employees. Yes, ma'am.
Thank you very much. I may be a literally one-person minority here, but I wish to speak anyway. It's kind of interesting that Republicans have been in control of government at almost all levels, presidency as well as Congress, for a number of years.
Well, tragically, we lost it at the House and Senate in 2006. So we have not been in control for the last 3 years.
But during the time when George Bush I was in, when Ronald Reagan was in, George Bush II, there were no attempts to change and reform the healthcare system. During that time, all the studies showed that the number of unemployed, the number of uninsured and underinsured, which is something you haven't talked to at all. A lot of people who have health insurance, but it really doesn't cover major situations when they occur, or as with my own daughter, I know in her family, and I'll make this much shorter, but you know, there's limitations to everything, so past a cap and they don't pay. So how come during that time when the Republicans were in power, the number, like I say, uninsured and underinsured rose, and healthcare costs skyrocketed? And the drug companies and the insurance companies have made a huge, huge profit. And of course, their administrative costs are twice that of Medicare, if not maybe more. So I would appreciate some kind of response to that, Senator McCain.
Right.
Thank you.
Thank you. Thank you for being here. One, we should have done more. Two, there were several attempts that were made, such as inauguration of Medicare Advantage program and some others. But we should have done more. We should have done more on a bipartisan basis. But we also needed to work more on a bipartisan basis, and we need to work on a bipartisan basis now. But there were a number of attempts. I'll be glad to give you many of those bills. And in the Senate, when you don't have 60 votes, then those can be blocked even from consideration. Look, I'm not here defending the spending practices when Republicans were in power. In fact, I fought against them at the time, and I fight against them now, whether it be Republican or Democrat. But obviously, healthcare issues such as medical malpractice reform were not going to be accepted by the Democrats either. But we need to do a better job, and the time is now, and I think we should. And obviously, there is plenty of responsibility to go around. But now we're where we are, and the solution proposed by the Democrats, in my view, will destroy the quality of health care in America. Yes, sir.
I appreciate this opportunity to ask you a question, Senator. I'm an 87-year-old veteran of World War II. I was very fortunate to survive the war, fighting with the 29th Infantry Division, and I think you realize where their position was in World War II in France and Germany. That's beside the point. I've been blessed by my God to have lived for these 87 years and 66 with my beloved wife. Years on Social Security. What country would support me for 23 years with Social Security payments far above what I ever put in?